Kanega, who will introduce everybody else that needs to be introduced. So, Amanda, it's all yours.
Great. Thank you, Joe. Appreciate it. This is our first in-person event in over a year, so feel privileged to spend it today with all of you, so thank you for your time. And I also feel lucky that I'm here to really explain a solution that we feel is innovative, but also an opportunity that we are leading in the country, really. And it's all starting here in Altoona. And again, I'm really excited to be here with Dr. Zane Gates, who's been leading this mission for years and founded Empower360 right here in Illinois. So thank you for your time. I want this to be interactive, so please just interrupt small group. Let's keep it intimate. It sounds complex, but what we've done is really simplified it all. If you have the questions, someone else probably has a question, so please just let it out, okay? So here today, we're here to talk about how our solution will deliver more care, which is the first part of the presentation, and the part that Dr. Gates will really speak to. And today with me is also Frank Spinelli, and Frank is here as really our analyst and financing lead in this program. So Frank will answer more of the less cost side. We've broken it into two parts to make it really simple, and basically the whole program is Empower360 and ICRA financing. With that, I'll get started. So where does it hurt? We are a small business also, so we're swimming in the same pool as everybody else, trying to figure out the best way to give our employees the best healthcare. Even though we are a healthcare facility, we still need to take care of our employees. So we also have a fairly lean team that gets stuck in paperwork and negotiations and managing and administering healthcare costs. So we know that that is somewhat painful. So we're here to address how our solution can be a really strong way to change that. Money, we know that we see double-digit increases in policies. We feel that ourselves. It's frustrating. It's difficult. You feel like you can't, get out of that mess. Well, we're going to give you some ideas of how to do that. Cost for employees is going up. People are not going to the doctor because they don't want to pay their co-pays. They've got either high deductible, so they're avoiding care, so they're not even doing preventative care. So that's a challenge. And we're not getting any breaks from the carriers. The carriers continue to go up and reap the benefits of the increases. The brokers, who you may see one time a year, are also getting commissioned on those increases. So that's another pain point. And also, as you're trying to recruit, it's really important from a hiring, a retention, and an overall satisfaction standpoint to have a competitive benefits solution. And again, with all these drivers that are making it more difficult, it's hard to present yourselves that way. So again, we understand that, and it's really important to attract great people and have to train them. So for you as the employer, today we want to share a solution that provides more guidance, more collaboration throughout the year. It's not a one-time stop. More freedom from this administration, more time to grow your business and do what you love and spend it with clients, customers, and attracting and growing new partners, more confidence that your people are being taken care of. So we want to really take all of that off of you and put it on our solution. And what it does for your people is they can spend more time with their providers. Everybody walks in for their annual, you're spending 5 minutes walking out. A lot happens in a year that you're not even able to cover in that small appointment. We want to provide more services, not less. So we're not cutting costs or cutting care. We're cutting costs, but we're not cutting the care. It's a really important thing. More personalization. It's not the same plan for everyone because everybody's circumstances are different. I have 4 kids. I have a different plan than the 25-year-old who has no kids, is not even married. So it's all personalized based on your employee base. More savings, and then overall more health. That is so important here, that we are actually delivering a better solution with more care. So a higher level of care. This is where I'm going to turn to share this really brilliant model that Dr. Gates has come up with. So this is the more care piece of it. And we want to spend a few minutes really helping you understand Empower360 before we tell you about the most amazing.
There's people in this room that are already in our plan, so they can tell you firsthand how well it works. And they're money involved. The thing that was most exciting about me, when you remove the elements of insurance in a medical office. You can start to really start to provide the care that you need. That's the whole thing that's more important that we've got lost. One, medicine is no longer in the customer service business. Take it or leave it. And two, you shouldn't have people that are working or not working, but especially working have to make choices of whether they're going to see their doctor and get their labs, or their daughter's going to get into a ballet club. And that's what, those are the hard choices people are making. And so that's why we developed a model where there are no co-pays and no deductibles and better care. So first, let's start with the primary care part of it. Our clinicians are not allowed to see more than 15 a day. Why is that important? Because they get to spend more time with you. We also have a dietitian because nobody knows how to eat, including myself. And I've learned an awful lot. And in your current plan, the only way you get to see a dietitian is if you're a renal failure, which is too late. For most diseases that cause renal failure, you should have saw a dietitian long before that, or you're diabetic and it's limited and has co-pays and deductibles, which are really hard on a family. And also, the most important part is, I think, the care of how we care for individuals. We found that people do better if they're cared for. That's what we've lost in the country in primary care. We also have telemedicine features I'm most proud of. You can see any specialist, most specialists from Allegheny Health Network, endocrinologists, rheumatologists, neurologists, etc., with your primary care provider. And we think that's a really neat thing because, first of all, I've learned a lot. I've learned how much endocrine I don't know. And I've learned how to take care of the patient afterwards. And you get to see a specialist. It's like bringing your specialist to your primary care physician, to your specialist appointment. I'm able to tell your specialist things you would never think to tell them. When a specialist has to see you and has to figure out, because in the advent of electronic medical records, when I first started this, they gave these wonderful dictated letters that would tell you kind of the natural history of the disease, and you really understood how to manage patients after that. Well, now it's all templated on electronic medical records, and it takes a specialist a long time to figure out your story. I give them a good picture of what your story is, and now they know how to start the treatment process. Then we discuss your case together in the room, and then I have a treatment plan, and you'll see it 2 to 3 weeks afterwards to see how things are going, and the specialist will see it whatever the schedule thing is. So, and there's no copays and no deductibles. Again, anything that we do has no copays and no deductibles. But primary care is great, but it's not enough. So what, can you go to the slide? Yeah, the one before that. Yeah, the 92% of all the possible labs you could ever have is covered in our place. And as our places get bigger and bigger, that'll start to approach 100%. No copays and no deductibles. That's wonderful that for diabetics and people with chronic disease who need 4 labs a year. But what I've learned and why it's direct primary care has been around for a very long time, the last 10 to 12 years. But we felt it's just not enough. So we added a bunch of other services with no copays and no deductibles that you don't have to make tough choices to do, like physical therapy, Blair and Blair counties, our partner, cardiology testing, that's echoes, stress tests, all imaging done at 611 MRI, pulmonary testing, durable medical equipment, CPAP machines. There's lots of people that need CPAP machines and aren't using them because of the expense. Well, that's all covered. Braces, wheelchairs, behavioral health is big. People underutilize behavioral health. And in our office, we screen everybody for substance abuse and mental health, because that's a big issue that it's disjointed from primary care. And in the old system, I couldn't even call and find out from your psychiatrist or psychologist what's going on with you unless I have a complicated release and these things, and it makes it hard because I need to be involved in that. But we have a person that screens everybody. If we find that there's a problem, they have an intervention, a social worker, a licensed counselor, and then we send it out to Knowlton, who's our provider. And then we have expanded generic drugs. That means you have the same formulary you have now in generic drugs at any Thompson's pharmacy with no copays and no deductibles. And all the acutes, such as antibiotics, cream, for allergic reactions, and prednisone. That's all given in those packs at the office. So because if you're feeling sick, it sucks to have to go wait, and try not to make you wait, but wait at the doctor's office, and then go wait at the pharmacy. You get it all one place, one time, at there. And obviously our physician supports 24/7, so if you have a physician on call, and if you choose you want a telemedicine visit, you can have a telemedicine visit. You can't make that. But that's just part of the story, because again, then, as you ever see one that you give a cat milk and they want a cookie, so then I said, well, maybe I need to add more services, and if you bundle these all together, you can continue to bring more and more healthcare for one fixed price, because that's the problem. So we added a chronic disease management program, and tech that goes along with that, and we have something called New Era RX that's embedded in it, so that if you go to the pharmacy, first of all, you can call a pharmacist at any time, Monday through Friday, get questions in it. And you also have a service where if you walk up to the counter and it's a branded drug, and you can't afford it, you call one of our pharmacists. The drug companies have very, very generous couponing programs that just aren't used because it's not worth the while the doctor's office to do it. It's too expensive for them to take the time to do it. And it's not worth it for the drug plan. Only in specialty pharmacies will. And in our plan, you call, you can't afford a brand new drug. Our pharmacists will work on it, keep on it, and send it to you on your phone. You walk back up to the pharmacy and get it. And it's significant. Like insulin, you can get that for $25. Some of the more expensive drugs like Eliquis, that's used for blood clots and things like that, that would normally on a good plan, cost you $100, you get it for 10. So these are the kind of cool things that we can do that's already embedded into the package. Basic women's health care service, we have a nurse practitioner who specializes in women's health, and we have it for peds. In some offices, we have family practice docs that do pediatrics, but where they have an internist like me, we have pediatric services. Dr. Newsom, the Cruises group that you saw, and that's where you get all your pediatric care with no copay and no deductible. And the biggest thing is, as I say, no out of pocket. That's the thing that's most important. We want you to consume more health care. This country needs people. The rest of the world, primary care is valued, and they have no copay and no deductible in most countries, developed countries in the world.
So this basically covers all the predictable needs somebody has. We've definitely broken it down. I think this is 85% of your healthcare costs. Yeah, in a very comprehensive way.
But here's now, you're saying to yourself, okay, this sounds too good to be true. And they can tell you, is it too good to be true? Now the problem is the insurance part, right? What do I do when I'm admitted to the hospital? I need branded drugs. I have an emergency room. I have outpatient services. Now, before when I spoke to you, large self-funded plans we could fit in. But the groups under like 100, 200, it became more difficult to fit them in because we're taking so much out and they're not giving enough credit in the insurance to make it the package complete. So this is where my good friend Frank and I was chasing Frank down for a while because I knew he had something wonderful for people, and I finally convinced him that his financing model for insurance using the individual market is great. He's going to explain that to you today. Of, okay, what happens when I have to use something outside of the place? So that was a great transition.
Thank you so much. I appreciate it. I truly believe he didn't have to convince me too hard. I truly believe in the model that Empower360 offers. I think our fee-for-service, model in this country is a self-fulfilling prophecy when you're seeing your doctor on average for 3 or 4 minutes while after waiting a half hour for them. On to the next is the motto there. So it's a great model, and we're excited to be partnered with them. You have a slide.
Well, we wanted to show you a video of why we're not just another practice or another healthcare model. This is who we are and what we believe, and we want to show this to you because we think it's so important for you to understand why we do what we do and where we're going yet.
You have to push play on the bottom left.
My name is Dr. Zane Gates. I'm co-founder and medical director of Empower360 Center for Health. What fueled my passion was my mother, being a single mother in housing projects of central Pennsylvania. Because of the way the welfare system was in the 70s, my mother carried a different medical card that had different benefits. So because of the fact that she didn't have the right card, she didn't get the catheterization that she needed and died because of it. To me, that's the most unfair thing in the world. What did she do so wrong? She raised a kid that became a physician. She walked to work every day. What did she do so wrong not to get the care that she deserved? But that's what fueled me and wanted to make a more equitable healthcare system. What we developed 10 years ago was based on a paper I wrote called Lessons Learned from Game Theory about healthcare price inflation. I took a look at the American healthcare system and wanted to change the paradigm.
I'm Jordan Taradash. I am CEO and co-founder of Spark360 and Empower360. So what we looked out to accomplish together is our theory was, let's not try to fix the healthcare system. Let's go back down to the foundation, figure out how do we build a healthcare system that thinks about people, patients, members first, and then build all the care and the delivery around it. We had the unique opportunity to do that.
Instead of putting the insurance first and developing the care around it, we divide the care model and provide, then wrap the insurance around it. This makes it patient-focused instead of insurance-focused.
You don't have to choose or interact with 4 different healthcare systems or 4 different platforms. We come together to deliver this unified integrated health delivery platform focused on one thing, maximizing the health and well-being of the people we work with and also minimizing cost. Why we get up every day and work incredibly hard is because we know the work we're doing is meaningful and impactful, and that's what joins the entire team together.
So, it was, as Zane mentioned, it was difficult to pair this with a fully insured plan that was smaller in size, not self-funded. And along came ICHRA, and ICHRA is the Individual Coverage Health Reimbursement Arrangement that first became available on January 1st, 2020. It was written, the regulation was written by the Departments of Labor, Health and Human Services, and the Department of Treasury. And it says for the first time that groups of any size can help their employees pay for coverage or pay for all of their coverage in the individual health market. Prior to that, an employer could not take the deduction to have their employee go out into the individual market and buy coverage. And so what this new model does is allows a group of any size, there's no size limit, high or low, to give their employees an allowance of sorts or contribution monthly, and there's no contribution high or low limit either, on a tax-free basis to go out and buy whatever health insurance fits well with each individual employee. So the individual employee, it's a more personal, more specific to that employee choice, because as you know, in the individual market, there's lots of different choices. There's bronze, silver, gold, and so depending on how an employee interacts with healthcare and what their needs are, will drive them to the choice that they make. So, I think the death spiral that most small businesses are in, and some large businesses, is the kind of the formation or the way a group health plan is put together. So if I'm a group of 50 lives, and I have 50 employees, I go out to the group health market, PMC or Highmark, I select a plan. I'm going to select that plan, and the insurance carrier is going to then pool me with other groups, because what they need to do is they need to get to a place where they can institute the law of large numbers in insurance, meaning you need enough people in a pool to be able to then underwrite or actuarially decide how much money we need from each person that comes through the pool. So we have this pool together. So some groups might perform very, very well. They might have very healthy employees. They don't spend a lot. Maybe they're only, they're giving the insurance company $200,000 a year, and the insurance company is only paying $100,000 in claims. But then there's other groups in that same pool that maybe they're spending they're giving the insurance company $200,000, but the claims are $400,000. What happens is, at the end of the year, the underwriter looks at the experience and claims that have been spent through that pool, and what happens is it creates what's called a trend increase. Okay, so that group that maybe was performing well is going to see a 8, 10, 12% increase. I'm doing well. What's going on? Why am I getting an increase? And the real benefit to an ICHRA is you're no longer, as a company, responsible for your claims within your employee population. You're no longer responsible for it. The only thing you're responsible for is to identify how much you're going to give as an allowance to each employee to go out and buy health insurance. And that can vary by age. It can vary by single employee, and you can also decide to then also contribute to dependents at home and spouses. And so the model becomes very flexible. You can use it strategically. And what we found in doing our work together over the past 4 or 5 months is that you can do it and fit the Empower360 model into the cost of the health insurance that you're going to spend as an organization, and do so at sometimes a price point less than what you're paying today in the group health market. And it doesn't always work that way, but when it does, I mean, that's as Daniel says, winner, winner, chicken dinner. But sometimes it doesn't. Maybe you're spending more today than you were before, but remember that trend increase. And remember the trend increase in those years where you have bad experience, where your trend increases in 12%, but maybe 20 or 25. And so over time, this model stabilizes an employer's cost, where you can sit down at budget time and really identify specifically what that's going to cost you. If you start in ICHRA today and you identify your cost, you can renew your plan at the same cost next year. And then the following year, you may want to play with it a little bit. If you had a good year, you might be able to increase a little bit. If you had a tough year, maybe you pull back a little bit, but it's your choice. Instead of the group market, you're kind of held captive. You're saying you're going to go to PMC, Highmark, any other option, and then you're going to get quotes back, and you have to choose one plan or the other. So I think that this model has proven to work well. My experience, my work experience for the past 13 years, as an insurance consultant in the group health market. I ran a practice that had about 1,200 groups in it. And when ICHRA became available, January 1st, 2020, we launched 6 of our companies into an ICHRA model. Since then, we added quite a few, almost 100 groups in ICHRA. And as of January 1st, 2021, this is all I'm doing full time is ICHRA. So we see this as a real game changer in the industry. And when you pair it with something as powerful as Empower360, it allows an employee to get better care at the, at the primary care level, and potentially maybe not have to buy as much insurance. And maybe that employee could decide, you know what, do I need a $2,000 deductible if I have all of these services through Empower360? Now, some employees might say, yeah, I do. And that's the case, they can make that decision. But those that don't, and I can tell you that all of our analysis through our group health, my group health experience shows that 80% of the people are overinsured. Okay? 80% of the people don't even come close to hitting their deductible. There are that 20% that do, and that's okay. That's what insurance is for. But when you put it all together, this model really works out fantastically well. You can go to the next slide. So I kind of talked through kind of the benefits for the employer, it's the stability, it's the it gets you out of the volatility of that group health market. For an employee, it increases choices. It makes their insurance purchase much more personal. When you as an administrator or a business owner go out to the group health market, you'll decide with that group health market based on your budget. You're going to pick a plan, or sometimes 2 plans, or 3 plans, and then your employee chooses between one of those 2 or 3. When they go to the individual market, they may have 20 different choices available to them. And so it's important because it's a real paradigm shift for an individual in terms of what they want to, how they buy. They don't understand insurance. We do it every day, and sometimes I get, and I have to put it all together in my mind. So it's a difficult thing for an employee. So our model, our ICHRA model that we built over the past 18 months includes every employee speaking to an enrollment counselor, one-on-one. Our enrollment counselors learn about what they need, how to interact with healthcare. Often we see a doctor, with doctors in hospitals need to network, all that, and then we'll speak to each employee sometimes once. They're easy employees say, yep, that's fine, I want them good. Sometimes it's 6, 7 times until the employee's comfortable making a decision. But we give them that help along the way. There's a mention there, people leave work, leave a job, go to another job, take a consulting job. These individual policies are owned by them, they're not owned by the company. So they can take them with them if they leave your employment. So that's always a good thing. Be eligible for a government subsidy. So sometimes, like if there's ever a pandemic, people don't know this. It's difficult. No, people don't lose their insurance. That's the thing. It's exciting. It's there. And no other country in the world does the individual is like the employer-owned insurance. America's rare, and that comes from World War II. Whenever they couldn't give more wages, they gave health insurance as a benefit, because there was short workforce. But now that's outdated. And you pay the rest of the world, every individual owns their own insurance. And so, we look at, in terms of the financing structure, there's kind of like 3 buckets that we look at. First is a plan design for a group. So certainly you have a budget, you know how much money you spent today, how much money do you want to spend going forward. So it's a matter of putting a plan design together. So deciding how much you're going to give to each employee. Are you going to offer single coverage, employee spouse, employee children, family, all that. With some financial information that we have today, shared with our team here, we can put a model together for you. It's not going to be on you to put the model together. We're going to put the model together and talk about options. So that first phase kind of is that plan design phase. Once you decide, hey, we're going to go for it, we're going to do this thing, then we go into kind of the communication, education, and enrollment phase with employees. We have a website built for you, a portal we send all of your employees to. Flex their information if they want to quote. There's videos on there explaining to them what's important. In ICHRA, what it's all about, how do we get covered, those kind of things. And once they make a choice, our team will enroll them into a plan. And once all enrollments are done, which is a big deal in terms of what we have and what we built, we have a payment technology in place that some ICHRA models across the country, not many, but most, well, every one I know so far, let's put it that way, requires an employee to actually buy the coverage out of their own pocket and then request reimbursement through a third-party administrator. And we quickly learned, because that was the first 6 we did on January 1st, 2020, that's what it was. We quickly learned that was not going to be sustainable. Some employees literally can't fund a bank payment. So we, dumb luck would have industry, and on June 1st, 2021, we launched a payment technology, which now allows the group to actually buy the coverage for each individual. So you, as a company, you would fund the aggregate premium amount into a trust, which then allows my team to make individual policy payments to each and every carrier on behalf of each employee. And then if your employee leaves your employment, you terminate them right through the portal. Hire somebody, you update your eligibility list, and we keep complete control and know exactly who's being paid for what. And if the employee goes over their allowance, then it comes back to the company through a payroll withholding, just like it is today. You're buying the entire policy today, and the employee pays their share for a payroll withholding. What happens the same way, and obviously we'll help you with all that. So those are the kind of the 3 buckets that we look at. And up there, so I haven't been
Amazing job.
looking, but yeah, I'd love to take any question. There's a lot more to it. We're trying to keep it as high level as possible, but I can tell you this: your employees are going to have a great experience with our enrollers. They take our time, and it's important to us that they have a good experience. That reflects on you. It's going to reflect on us and the Empower team, and we want good experience. And you're going to get help along the way as well in terms of learning how to do this new thing. It's different, but literally after a couple months, you get the hang of it. I'm happy to take any questions.
Yeah, the thing that was most exciting to me is that the big thing is we're buying health insurance instead of healthcare. That's the problem. By getting all the Empower360 services, we know that we're giving your employees really good health care. They choose what level of risk they want. That's the thing I think that's neat about it. You guys just throw in these plans, and some people are like, oh, hey, you're giving me this, and I only have a $6,700 deductible. I'm 26 years old. I just need something to protect so I don't go bankrupt if I get really sick. Right. That's my risk. That should be between your employees and their insurance, how much risk they want to take. Hey, I don't want to take much risk. I'm going to pay a little more. I'm going to get the $1,000 deductible. So it leaves you out of it. And really, employers shouldn't be in the business of healthcare. It's extremely complicated. It takes resources away from you guys and learning all these things. And how to do it, if you can spend it on other businesses and other things to keep the lights on and do all the things you need for your employees. And it gives the power back to employees, literally, a family. And each individual, one husband could take a $6,700 deductible plan, and his wife said, all right, I don't know, you can take a $1,000 deductible plan. So, yeah, so that's the thing I found. It's your size of healthcare, not the one size fits all. Because just like in medicine, every patient that comes and sees you is completely different. Everybody has a different thumbprint. Everybody has a different food they like, and they should be able to pick what kind of healthcare they want to choose.
And some of us like health food.
So by removing the risk, getting you out of the insurance business, you can actually design a model that will keep everybody healthier. I mean, insurance is designed for sick people. Our healthcare model is designed literally to load it upfront with preventative services, healthcare coaching options, the dietitian. I mean, you saw the list of services are all still listed here, but it's a combination of the technology, the preventative health, plus the full service of primary care and extended health.
So we're going to continue to have a group of 1 500. Yeah, so, that's nice.
I do have a question. We're a very small employer, but we have, a reaching market where our employees live. A lot of them live in Cambria County or even Somerset County. But of course, we're based here in Altoona, so how would their services work?
We have a Johnstown,
Okay.
and we member hospitals, and Lifeline as our, as our partner in that. So they can keep those, and then Frank can't explain how they do it, but
You'll make that decision based on the costs out of their individual market. So there's 10 different employee classes and 10 different ways that you can design your ICRA. If you're a small company, you don't have to offer any insurance today at all. You're not at risk of penalty. If you're a group over 50 lives, you're considering a large employer, then you have to make sure it's affordable. But you don't. So you can just decide based on your employees and maybe what they're paying today, or what they're buying today, how you want to structure your plan. And so if if you have folks that are different areas, maybe buying insurance from different price points, we'll do that research for you while we're doing your plan design to kind of help you decide, okay, if I give them this much, how much will they have to spend for it? And then you can make a decision based on that. And of course, it'll be what you spend today versus what it might look like when you put it all together.
And the value of that research, the analysis that Frank and the team put together, they break it down by where the employee is located, see all the plan options, whether it's high market, you can see all the levels. You literally feel so informed when the employee chooses and says, this is the one that's right for me. So it's that research and that consultative experience that makes everybody feel like they really understand their plan and they're going to utilize it. And we want people utilizing Empower360.
Right.
And that's why how our plan is designed.
And there's some people that are outliers and people, hey, I'm gonna change my dog. They don't have to, they're not allowed to use medical. I'm gonna choose a $2,300 deductible plan, and that's good for me. Their choice. And that's the power of it. You're out of it. You're just like retirement. It's a defined 401k. What it is. What they choose to do with it, that's their own personal business. It's like their own healthcare is their own personal business. Their own personal business. So you might have 90% come to Empower, you might have 10%, you still can choose whatever you want.
Does that apply? So we have a second location in Maryland.
Yep, applies to Maryland.
So we have employees here, we have employees that live in Maryland and employees that live in West.
That's fine. That's fine. They may not all get to utilize soon, but they may not all get to utilize Empower3, but they still can get better coverage and save you money. And be back, they can, those, go into the individual insurance guy. Talk to them about the difference between, I want you to understand why it's better to put your small group into a bigger pool. And I can't talk about that because I don't have
We
an
have to
insurance
keep roles
license.
separated.
So,
Right, insurance.
That's only a specific topic.
I know.
But the point is, the ACA market is just a larger pool. So if you have a group of 20 employees or 50 employees, you might be in a pool with maybe another 50 or 60 employees until they get to a point where maybe they have 40,000 people, 30,000 people. And the individual market is much more broad than that, so it's much more stable. What's great about the individual market, originally, when it was first kind of offered way back when, there was really no penalty. There still is no penalty for an employee not to be covered. So the young and healthy folks are saying, yeah, I'm good, they're invincible, they don't need anything. And the people that were in that market were people that absolutely had that. They're going to use a lot of healthcare, they're going to bankrupt, they don't have insurance, so they were in there. So there's a lot of adverse selection in that individual marketplace.
Small business.
For small business and individual market, but over time it has come down, and we're starting to, we've seen over the past 3 or 4 years, the individual market actually come down in price instead of go up in price on big averages. And so, when you say West Virginia, Maryland, PA, we would look at each of those price points and we probably just design different classes for them if those price points were different. If they're very similar, then we'll pull them together and we'll do one class here at this level of reimbursement, and West Virginia at a higher level of reimbursement. Guaranteed West Virginia is higher. So they just don't have the barriers or the medical, all that. It's just expensive there. But instead of those West Virginia folks in your group plan raising the rest of your costs for everybody, now you can just take your select folks in West Virginia, give them more money, and in the end, the way we try to design our plans are that each employee, regardless of their age, are going to spend the same money out of their pocket towards the contribution. So we design it in a way that the company is contributing an amount that would level set everybody for a specific plan in the market, or a level of plan in the market, like a silver level plan. So yeah, we could do that very easily. And then your folks in PA obviously get involved in power when they go to Maryland and West Virginia, and they can offer that there too. So.
Any questions? As a next step, if any of you are interested, that would be for us to provide you with a worksheet, extensive information, very obviously very compliant, that would allow us to provide the analysis. Obviously, there's no strings attached to the analysis, but generally, 90% of the time they're extremely enlightening. Just looking at the analysis, and we won't throw it over, digital email. We want to walk through it with you and really go through those numbers so you feel confident that you might want to take it to the next level.
One thing, the market's still open, the market is still right, so this isn't a situation like it used to be, you had to wait for January 1 to find out something.
Great
Great question.
You can do this any time of year. You can enroll, but everyone is re-enrolled on January 1st at the same. So, by October 1st, will be probably the last time you do enrollments, and you're going to have to do it in January. But that re-enrollment is really done digitally, and it's extremely very simple. So if you did even do it as late as October, you could do it on the tweet perhaps in January, and then have change, but it's a great design because you can do it throughout the year, or do it better. If you have a great experience, you could business that you want to get involved in it in like March or April, and you can do anything.
We just did one for yesterday. We went for August and launched one. So even now that you don't have the extended open enrollment that the government offered because of COVID, the initiation of an ICRA creates a special enrollment period for anybody there. So it can happen at any time. That's another.
Anyone have any questions in closing? We can't continue to go down this path. The small business market is in a death spot. And there's not a lot that anybody can do. It's a math law. And that's what people are trying to overcome, math. The scientific formula. Insurance companies just don't go in the air and pull out rates. It's an actual formula. And whenever you have, when the rates get high, you're the only people that are going to get this insurance are your sicker folks. Because what you'll see a lot of times in these small businesses look at, hey, okay, we got insurance. And then the younger house people use it once and go, I pay cash for everything. Why am I getting this? And then all that's left is the sick people in the pool. That's a death spiral. And there's nothing anyone can do to change that. That's why things like this are coming about, because the insurance formula was never designed to do what we're asking to do, right? If I had told you that you're going to cover a group with insurance and 80% of the people who bought it were going to use it, how would you ever pull down the cost? And the interesting thing about the small business market is insurance companies they can't find a way. Even brokers, aren't looking. They put young brokers on them to change them. They can't make that happen. So you, unfortunately, now are the people nobody wants. So, and I don't think that's fair. as I said in my video there, that's unjust. As they will attest to, I think, we do a really good job of customer service, and if there's a problem, we make sure. You call any other healthcare place, for the most part, they don't have the time or the financial model. If you got a business, you understand the threats. They have a business model where I'm paid just to see you. That's the only time. I'm not paid to call stuff in. That's a service. Then that's going to be my focus. It has to be. People on the license to service my family, do these things. They're not doing anything wrong. They're doing everything they can to survive. It's very difficult to find their practices or any small business to survive. This changes the paradigm. You prepare first for your employees and the insurance sector. So that's what the most exciting thing. A lot of your employees receive, and now they can afford a lot of things that they never could.
Play your video then.
No.
You can send a follow-up with all of our contact information also on the back here, we cover all these questions.
You just know the more people we get into this, the cheaper it's going to get.
What about like short-term rehab and long-term rehab, like nursing homes? If you have an injury of some type that, and like a stroke or something like that, you need to have rehab hospital, how many days would that cover? And
How's that covered now? This is why I say this. How's that covered now?
well, I think we have like a 60-day at the rehab, and then like under 20 days.
None of that will change. Remember, you're buying a UPMC or IMAC plan. So what they cover now, you're going to get. Nothing's going to change. And your employee.
I didn't see anything on here about.
Yeah. Whatever, think of it, whatever they cover now, you're going to get the same with us included. That saves you money over time. And it may save you money. Some people, it saves you an enormous amount of money right out of the gate. Most people, it does save money. Most people that we've done so far has saved the money in small groups. It gives you a whopping, much bigger benefit. And when we get into a question, we'll share you the 20 scenarios of when Joan sprained her knee, right? And Joan has what you think right now, a $2,300 deductible plan. Everybody in this room, pretty good plan, right? Now, in the current market. Well, Joan sprains her knee. Joan's paying. It's Jim and Tamara. Tamara is 36. She has a UPMC bronze plan with us, and Jim has a traditional $3,500 deductible, which most of what you're buying, $2,300 deductible plan. If he hurts his knee, got to pay $25 to go to the doc. Getting a steroid for swelling, that's $15. Then it's not working. He's got a $75 ortho. And they say, hey, we may have a pair. It's $1,200, $75 for the follow-up, and 6 weeks of PT is $200. So Jim is out of pocket, $1,630. Tamara, she's 36-year-old. She just said, hey, I'm going to buy I'm pretty young and healthy. I'm going to buy a high deductible plan. So she goes to Empower. It's a telehealth visit with an ortho. That didn't cost her anything. The generic steroid was free. The direct network ortho visit is free for her MRI, and then she follows up with if they can do it in telemedicine. If they can't, she does copays for that ortho, but for the most part, that's free. And then she has unlimited physical therapy visits, which cost her nothing. So that same scenario cost her nothing, even though her deductible was more than twice. Even though her deductible was higher.
Right, so saving a little bit on a lower deductible plan at 320 a month, you can save at all.
And this is where surprise billing comes in. Because see, if you understand how plans are built, they'll show you a new plan. You're like, oh, this is good. This is a $2,000 deductible, $1,000. But then, most people, has anybody in this room ever read their entire explanation of benefits? Has anybody ever read it? Yeah, you.
They read it,
But, yeah, you don't remember it, and you don't find out how much things cost. until there's no other entity in the world, you don't find out how much things cost until you use it. Oh, I didn't know. Hey man, I paid someone $1,000 deductible plan. Well, you know you have to pay $2,500 a day in the hospital, up to $8,000. You understand these plans? They're all designed to get the max out of pocket. They give you 26% co-insurance, and you think that you're getting a great plan by just looking at the deductible and most people aren't trained. It is extremely complex, and most people, that's how health plans make you think you're getting a better deal, but you're actually, when you really need it, you use it, you're not. So it's better to pay for services you know you're going to use up front, because you're going to save a bunch of money. Everyone's guaranteed to get sick, 100%. And everybody should get a checkup, especially if you're family history of disease.
Well, and that's why those deductibles and then the insurance is for the what if, the unpredictable. So we've taken all of that and pulled it together into our model.
That may prevent you from coming.
Right. Okay. Is there any vision or dental built in, or is that all come out of the other side of the insurance?
We would suggest that you stay on the group side for dental and vision, because the individual market requires an individual to be on a plan for 6 months before any major work can get done. So the plans kind of suck, and so you stay away from them. So we recommend that you stay on the group side for dental and vision life.
But someday, just give me time.
It's gonna go back into the lab.
Give me time. I can't solve all of it.
So, we really appreciate your time
Thank you
today.
so much.
Thank you so much.
We shared some valuable information.
Thank you.